Good evening, everyone. Sorry for being late this evening. Today is June 20th, and our topic today is on anxiety. Okay, so let's start with a brief definition of anxiety. So, anxiety is the intense and persistent worry and fear about everyday situations, resulting in panic. This usually causes the individual to avoid people, places, and situations that causes the anxiety. So again, when we talk about anxiety, it's an intense and persistent worry and fear. Okay, so the individuals who are saying that they're anxious, and you could clearly see the fear and the worry that's going on, the worry thoughts and all that stuff. Okay, and so that's the definition of anxiety. And symptoms of anxiety is nervousness, panic due to feeling danger. Many times these individuals are feeling as if they are in danger, which is the intense fear and the worry. Feeling as if life is in danger, or feeling as if something bad is going to happen. Okay, there's an increased heart rate, sweating, trembling, feeling tired or weak, poor concentration. They have trouble sleeping, or sometimes there's insomnia. They can't sleep because their mind is constantly thinking about whatever it is that's causing the worry or fear. So they have trouble sleeping. Okay, gastrointestinal issues, where they're having stomach issues, stomach pains. Many times, for me, for example, when I get worried, it responds in my stomach. My stomach starts to feel funny. I sometimes would have to use the bathroom. And so these are things to pay attention to when it comes to anxiety, as well as uncontrollable worry, worrying about what's going to happen, and uncontrollable thoughts. So these are some symptoms of anxiety. So again, anxiety is the intense and persistent worry about everyday situations, okay, and the panic in that. Okay, so types of anxiety, there's many kinds of anxiety. So obviously people could, anxiety includes the intense worry and fear, and so people could be specifically anxious about certain things. And so there's situational anxiety and situational fears, okay? So there's that, but then there's agoraphobia, where people are afraid of certain situations, and so they avoid the situation, they avoid those places, and that's an agoraphobia. There's anxiety due to health issues, and we'll talk about some health-related anxiety as well. So there's anxiety based on health issues. There's panic disorder, which is an intense anxiety causing shortness of breath, heart palpitations, chest pains. So when individuals feel like they call it panic attacks, and then that could lead to a panic disorder. Okay. There's also separation anxiety. Many times that happens with young kids, with individuals, where they may be separated from their caretakers, their parents, for the first time, and that causes separation anxiety. So that happens. There's substance-induced anxiety, where due to whatever substance that the individual may take, whether it's drugs or alcohol, it creates intense worry and intense fear, and that's more substance-induced anxiety. There's also social anxiety. Social anxiety is where individuals become highly stressed when they're in social settings, where they're constantly feeling embarrassed, where they're constantly feeling as if all eyes are on them. And I get a lot of that. I get a lot of clients who have very difficult time with social anxiety. There's a strong correlation at times with anxiety and substance alcohol use, because sometimes, especially with young people, college age people, they try to deal with the anxiety by using alcohol or using substances, because that tends to, with some individuals, tends to bring the anxiety down. With some, it may create psychosis and other things, causing being more hypervigilant, which creates more anxiety. But for some individuals, with their anxiety, they may use substances to help calm the anxiety. Okay, so some medical illnesses that's linked to anxiety. We have heart disease, heart disease, there's a link to anxiety because, again, you have a lot of people when they have the panic disorder or panic attacks, many times they're thinking they're having heart attacks. And so heart disease could be associated with the anxiety. Diabetes, chronic pain, asthma, and then people with thyroid. And so again, when I talk to clients about mental health, you can't speak about mental health without also talking about physical health because we're all in one body. So our mind, our body, it's all connected. And so when we talk about stuff that's physically going on with us, we also have to look at any physical issues as well as the mental health issues. And so when a client is describing something that sounds like, it sounds like you're anxious, it sounds like there's a panic disorder. However, we need to also rule out any physical issues as well because it correlates, it could coincide with each other. Some risk factors that increases in individual to potentially have anxiety. Obviously, if someone experienced trauma, if you experience trauma, that increases your chances of having anxiety. Someone with poor attachment. So again, growing up, a young child, if their attachment style with their parent is poor, then that could create anxiety. Hence the separation anxiety as well with that. That could create some anxiety. Stress buildup can lead to anxiety. Drug and alcohol use can lead to anxiety. So those are different things that could obviously lead to that. And so some mental health diagnosis that's connected to anxiety as well is you have PTSD, which is post-traumatic stress disorder. And then obsessive compulsive disorder. You hear a lot of people talk about OCD, having obsessive compulsive disorder. That's in association with anxiety. Okay. A fact, anxiety is treatable. Okay. Anxiety affects 18% of the American population and 1 in 5 teens. Okay, so some other things, like you have people who nail biting, that's a potential correlation to anxiety. So the thing about certain behaviors as well, certain behaviors become patterns and habits. So at one point it could have started due to an anxiety situation and turns into a habit or pattern. And so at some point people may do these behaviors, not necessarily because they're anxious, because that's now has become a pattern or a habit. However, the source of it could have been a source of distress, creating some anxiety to them at that moment. So you have nail biting, you have people who pick at their skin, you have people who pick at their hair, pull their hair. When individuals are exhibiting those behaviors, obviously assessing for anxiety is important at that time as well. Okay, so there's lots of treatment for anxiety, psychotherapy. And so when individuals come and see me and they bring up their concerns about being anxious, having uncontrollable worry thoughts, constant fear of the worst, bad things are going to happen, having panic attacks. So we talk about psychotherapy in terms of, well, let's kind of figure out where did some of this come from. And again, I'm a believer in going back to the beginning with clients. So I do bring up, let's talk about your childhood. Let's talk about your upbringing and kind of assess and see where some of the behaviors and some of this stuff was coming from. Okay. But psychotherapy is helpful in dealing with anxiety. A particular treatment in regards to psychotherapy is cognitive behavior therapy. So cognitive behavior therapy in regards to anxiety cognitive is the thinking process, and then behavior is your action, and then therapy. So with cognitive behavior therapy is recognizing what the thinking patterns are, okay, and then how our thinking patterns impact our behavior. And so first we got to identify the thinking patterns, and sometimes we have unhealthy thinking patterns, which leads to unhealthy behaviors. And so it's recognizing those patterns and then shifting it, changing it, adjusting it so that it becomes a healthy thinking to lead to healthy behavior. Okay, so CBT. And with CBT, there's a homework assignments, there's lots of tools of things to do in order to change the behavior. Okay. Another treatment model is exposure therapy. So with people with anxiety, I do talk a lot about gradual exposure, just small exposure to whatever the thing is that's creating the anxiety. So not only are we processing and exploring the feelings of what is creating the distress and what is creating to us and in us, but also how do we gradually expose ourselves to some of those things. Because many times people have anxiety to things, the fear of the unknown or the fear of what it may do to us. And with gradual exposure, we could start kind of really processing. Okay, so for example, it's a simple example, somebody who's afraid of snakes, for example. And so gradual exposure to that could be, well, you know what, we'll start with a picture of a snake. We'll just look at a picture of whatever particular snake that they're afraid of and see what's going on in their body, when they see the picture of the snake. And then eventually expose them to more and more things in regards to the snake. Okay? And the goal is to recognize what's going on in the body. Because again, with anxiety, it's an intense and persistent fear and worry. And it's responding to the body. Your heart is beating fast, your palm is sweating. So your body's responding to the level of anxiety that you're feeling. And so the goal is, the more we expose you to some of those things, then the less the anxiety and the less the stress your body will feel. But obviously, we got to process, we got to explore what's going on, because we don't want to recreate any traumas either. Okay? And so that's another form of therapy, stress management techniques. So in the moment of the distress, what are some things you could do? So deep breathing is really important. Again, breathing is about bringing oxygen into your body, because obviously when you're anxious, you can't breathe. And so at this point, you're not getting enough oxygen. And so really forcing yourself to really take those deep breaths and really calm your body down. Okay? And that takes practice, because now you're trying to manage the body with the stress management. So various stress management, such as visualization. So not only are you breathing, but then you may visualize a calm place, visualizing something calm to help calm the body down. Okay? So that's another thing. And obviously, medication, there's different forms of medication out there. Beta blockers to assist with anxiety as well. And so I do not prescribe medication in my practice, because I'm an LPC, licensed professional counselor. So I do the processing, I do the therapy. However, if there's a point where a client is needing medication, then I would refer them to a psychiatrist. So that would be a conversation with a psychiatrist to see if that's an option or not. Okay, so those are some minor things in regards to some things in regards to anxiety that I wanted to share. So hopefully that answered all the different questions that was out there. I kind of put it all together to do some education in regards to anxiety. Again, whenever you're noticing there's this constant fear and intense distress, intense fear and worry, then it's definitely important to seek help, because anxiety can be very, very crippling, causing people to not want to leave their home, want to isolate. And so, definitely seek help and support if you or anyone that you know is suffering with any forms of anxiety. Okay, thank you so much. This is Natalie Ellis from Esteem Counseling Services. Please reach out. I'm on all social medias. And so reach out to me at Esteem Counseling Services. Thank you.